7 p.m. each night. So we'd love to have you come be with us in the Fayetteville Citywide Revival. If you have questions, please call Reverend Patrick Monroe at 910-709-1263, or you can call me, Dr. Ron Godbold, at 910-988-1091. We look forward to seeing you at the Fayetteville Citywide Revival, December 6th through 8th, 7 p.m. nightly. God bless you.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we are going to talk about something that is very, very important to our community. We're going to talk about open enrollment for Medicare, health, and drug plans. So today, who we have in the studio with us is Cape Fear Valley Health's Senior Health Services, and his name is Mr. Sam Hutchinson. Now, Sam, he's been on the broadcast before, and Sam has a wealth of information. As a matter of fact, we were talking before the broadcast, and oh my goodness, my head is spinning. So let me officially welcome Sam to the broadcast. He is a social worker and office manager for Senior Health Services for Cape Fear Valley Health. Sam, welcome to the broadcast.
Thank you for having me on.
Now, first, the open enrollment period is started back in October. I think October 15th, was it? But there is still time for anyone who wants to enroll and make the changes to their current plan, because the enrollment period doesn't end until December 7th. But when you think about it, December 7th is really right around the corner. So, Sam, let's start Medicare open enrollment. Who qualifies for it, and what does it do?
Okay, so yeah, the open enrollment period affects those who are enrolled in a Medicare prescription drug plan or a Medicare Advantage plan who don't qualify for Medicaid or are not on the low-income subsidy. So other people have the ability to change plans up to 4 times a year during the year, but this is for people who are not in that category. And a lot of people are unaware of those other qualifications to be able to change during the middle of the year. But this is the time when you look at how your insurance has been working for you, and you know what it's going to be like in the future, and what's the best way to save money.
Can you tell us a little bit about Cape Fear Valley Health's Senior Health Services, and what you guys do for the community?
So Senior Health Services is a primary care geriatric office. So we specialize in folks who are 60 years or older. We have fellowship-trained geriatric physicians. We specialize in people with multiple different diagnoses with aging-related issues. We see many, many patients with Alzheimer's disease and dementias, and we are very supportive of them and their families. We have clinical pharmacists on staff. We have a clinical social worker, who's myself, who also has a program for caregiver support for patients with Alzheimer's disease.
Ladies and gentlemen, Mr. Sam Hutchinson, today's guest on Cape Fear Valley Health's Making Rounds Live. He is a social worker and office manager for Cape Fear Valley Health's Senior Health Services. Now, Sam, since I already know people are going to ask throughout the broadcast, where is your office located?
We're at the 101 Robeson Street on Suite 202. We're right across from Highsmith Hospital and across from the Airborne Museum.
Okay. Now, Sam, what if people are eligible? What if people are eligible or they're already receiving Medicare and they want to make changes, but they missed that enrollment period? Do they have to wait for the next enrollment period?
That's a good question. So yes, the deadline of December 7th, if you missed your deadline, then you made a change to a plan, then you do have to wait till January 1st if you need to change something. So if you don't qualify for a low-income subsidy, you don't have Medicaid, this is your opportunity to do this. So there is a time constraint for people who fall in that category. However, if you make a change now and you decide you don't like it or something goes wrong, you have between January 1st and March 31st to change back or change to another option.
Mm-hmm. Now, what if they don't want to make changes to their plan and they miss that deadline?
That's fine. You can just ride that plan out. The plan would have had to notify you by mail if they plan to not continue to serve in this area. And you're welcome to keep the plan you have as long as it's been working fine. You should kind of pay attention to any changes that may be upcoming because you don't know that plan is going to work as well as it did last year. Its networks could have changed. The cost of your medications could have changed. So it's always, it's kind of a gamble if you don't take a look at it and make sure that next year is going to be as good as last year was.
Ladies and gentlemen, in the studio, Mr. Sam Hutchinson. We are discussing Medicare open enrollment. And if you have any questions for Mr. Hutchinson, what you can do is you can, two ways you can get those questions answered. First of all, you can give us a call here at WIDU. Telephone number is 910-483-6111. Or if you're watching the live stream by way of Cape Fear Valley's Facebook page, you can leave the questions in the comments section, and Lindsay will make sure that we get those questions answered for you. And the third thing I want you to do is make sure you share the broadcast. Mr. Hutchinson is going to give some very valuable information during this hour, and it's information that it's going to be so much you may forget something, and this is information that is too valuable for you to forget anything. So we want you to share the broadcast. And once again, in the studio, Mr. Sam Hutchinson with Cape Fear Valley Health's Senior Health Services. Now, Sam, before we went into the broadcast, I was telling you about my personal situation and what I've been paying attention to. And as I approach 65, and as I approach the senior Social Security is what I'm trying to say. One thing that I noticed is I'm terrified. Can I be honest and say that? Because Darvin was always the one that handled the insurance. Darvin was the one that took care of all that. So now, as I was saying in the beginning, all of this is on me now. And Sam, I'm terrified. So what advice do you have for people, or widows especially, who are walking in my shoes right now?
It's horribly overwhelming. Every year when this period of open enrollment comes up, I've been following every newsletter, everything comes out from Medicare, all the podcasts, trying to figure out what to expect. There's a lot of speculation of what's going to happen, and then there's a final rule that happens. So it can be horribly confusing when you're just sharing notes with people. In North Carolina, we have something called the North Carolina Senior Health Insurance Information Program, SHIP. You may have seen commercials on TV. They're the one-stop shop for seniors to help navigate this system. So they have a hotline. We have local volunteers here that are helping with that, and that's stationed out of the Cumberland County Coordination Council for Older Adults. They're doing right now workshops, and they're sitting down with people at the computer and helping them enroll in the right type of plan. So their information is there. It's just accessing it. Medicare has a wonderful website, and it's a tool that if you're comfortable using it or you have family members that are comfortable using it, you can really research and do some good digging about those plans that are out there, how they work, how much it's going to cost you, so many different things. But it's still not enough. It's still overwhelming. And unfortunately, a lot of our information comes from a position of bias through people who are selling products, or heavy marketing is sent out. And so you don't always know that what you're getting is 100% true. So it can be very overwhelming.
And the commercials that we see on television, that doesn't help.
No, it's relenting, and it can cause some fear. So you're not mandated to change. You're not mandated to choose an Advantage plan. Medicare still exists today. You can keep original Medicare, but I've had one of the biggest questions I probably get is, do I have to change away from Medicare? And the answer is no, you don't.
All right. Now, Sam, what are some of the reasons that a person might want to change their Medicare plan?
So if you have a Medicare Advantage product, you have to make sure that the people you're seeing are in your network. That's key and it's vital. Otherwise, you're going to be forced to see providers that may not be your top choice to appease the insurance company. Sometimes you're going to look at your benefits and say, well, maybe I need to add a dental plan, or maybe I need to get some additional benefit on there that may be helpful for me. So you have to consider, I want to add an Advantage product and surrender my Medicare and instead have a better product that's serving my needs. You really got to look at those things closely because it's always give and take in those kind of things. Medication costs is the number one thing. I see people come in. A gentleman called me last week. One medicine was $512 a month, and we worked together on this and got it set up so next year it's going to be $12.50 a month. It's a huge difference. But it's navigating the system to find the best way of getting that one particular drug. And sometimes people are on 12 drugs, so we have to do it with 12 different drugs. It's time consuming.
Why are there so many hoops? Why are there so many? There's so much red tape. There's so many hoops that a person has to jump through. Why?
It's complicated because the insurance companies want to make a profit, and so they have to figure out a way of doing that to be appealing to a consumer, but then still make enough money to continue to function. So it's tricky sometimes to explain why one medication on one plan is $12 and on another one it's $500. It's they're having individual contracts with manufacturers of the drug. You have individual contracts with pharmacies. And so in every region of this country is different as far as their pricing. So you have so many complications to consider when you're trying to figure out which the best route for me. It just is it is overwhelming.
Ladies and gentlemen, in the studio, Mr. Sam Hutchinson on Cape Fear Valley Health's Making Rounds Live. Sam, let's get back to the changes. What if a person thinks that they want to make a change or they discuss their option? Wait a minute. If a person does think they want to make a change or discuss their options, what do you recommend that they do so they don't fall into the cracks?
So, if you get a plan that you think is going to work for you, first thing is call all your providers and make sure that they are in your network. Make sure that the medications that you're on are covered and are covered at the lowest possible price. And then, always remember that I can stick my toes in the water, and if I don't like it, if I have some bad experiences early in the year, I have up to March 31st to change my mind. Now, that's not advertised. That's not something that's out there because, it's all about open enrollment. It's all about making that sale. Mm-hmm. Once that happens, most people don't know they have a way of backing out, but you do. So you can always stick your toes in a little bit, give it a try, and see how it works. The problem is sometimes you don't feel the pain of it because those doctor bills don't roll in until well after the 31st. But, always ask questions. If you're getting procedures done, say, hey, I got a knee replacement. Talk to the people who schedule that. Says, hey, how does this particular insurance work with this? And they'll give you the truth of what problems they've had getting authorizations for things, or which plans work actually better or easier, or, who has better outcomes.
Sam, does Cape Fear Valley Health's Senior Health Services offer help with all of this? I know you mentioned it earlier in the beginning, but I know I want the listeners to really hear this because, as I told you, as I approach that time, I'm getting really nervous. So that's why I want people to know this. And do they have to have any organization, or do you have any organizations that help seniors with their questions and their concerns?
Absolutely. So Senior Health Services has been an organization that's been around for, I think, 30 years now. And we've been serving those patients who are underserved in the community. who have the most socioeconomic challenges to their health care, the most complex health care plans. And we've always had a holistic approach to that. We understand it's not about just seeing a doctor and getting a medicine. It's about treating the person as a whole person, treating the family that they rely on for care, and being part of that team. So we're always open and welcome to help people, anybody we can. My comment to everybody is, hey, can I have my friend call? I said, you let anybody call who you think I can help. And that's what we do at Senior Health Services. It is not just a doctor's office. It is a holistic approach to the care and welfare of folks. But as far as the insurance companies go, yes, we help with that. But our partners, such as the Coordination Council on Older Adults, through the Department of Insurance, the SHIP program, that's where most of that support is coming. And every county has that support available to it, not just Cumberland County. But it's a lot of people in the trenches working very hard every day, doing some very complex things to just try to make a difference in people's lives.
Sam, if a person, well, let's talk about the scams, because I know there are a lot of scams out there, and I've read enough and I've seen enough to where seniors are the targets, and it's not fair, but it's true. So what are the common scams out there that people might run into during this enrollment period?
So scams are, there's not a season for scams. It seems to be rampant. And every day I do have the experience of hearing from our seniors who have fallen into some of those traps. I have had staff members fall into some of these traps. It's nothing to be ashamed of. You have to understand that these people are very good at what they do. The number one rule is do not give out your information to people for any reason. If somebody calls you and says, I am from somewhere, you hang up the phone, you look them up on the internet, and you call them directly. If you say, hey, Medicare's calling, Medicare will never call you, never. So they correspond by mail. So those kind of things, if it sounds too good to be true, it is. That golden rule has not gone away. So always be skeptical of everything. Like I said, personally in my life, nobody's ever called me to give me something that was so wonderful. It was always more in it for them than me. Mm-hmm. That's just the basics of scams. And so with seniors, yes, there's scams about failure to appear for a jury summons. There's ones about your family member is hurt, you need to wire money. There's relationship scams where they're chatting to people who are recently widowed, and people are looking for companionship. It's just so many different things, and it is very tragic.
Ladies and gentlemen, our guest today on Cape Fear Valley Health's Making Rounds Live, Mr. Sam Hutchinson. Sam is with Cape Fear Valley Health Senior Health Services, and we're talking about Medicare open enrollment today. We're talking about concerns that seniors have as I enter that threshold. And if you would like to get in on this conversation, feel free to do so. What you can do is give us a call at 910-483-6111. That's the WIDU studio. Or if you're following the live stream on Cape Fear Valley Health's Facebook page, you can leave the questions in the comments section, and Lindsay will make sure that we get those questions to Sam. Or Lindsay's amazing. She'll probably be able to answer the questions herself. But, and another thing I want you to do is I want you to share this broadcast, because Sam has some very interesting information. And usually when Sam is on the air, excuse me, this is usually one of the highly viewed broadcasts because of the information that we bring during this particular show. And again, Sam Hutchins, our guest today on Cape Fear Valley Health's Making Rounds Live. Now, Sam, you did mention some of the red flags that people need to watch out for. Are there any that are in your face that people need to watch out for, like the ones that are obvious that seniors may not be aware of?
Yeah, I think you got to be careful of some of the Advantage plans, what they offer as these extra benefits. Sometimes it's a transportation benefit, and they'll say, hey, there's 20-some rides a year, but then you look at the fine print and it's one way. Well, we don't have one-way trips to the hospital. So you got to look at the benefit and make sure it's as good as it sounds. There's a product that has a debit card, which is very popular for patients who are dual eligibles, meaning you have Medicare and Medicaid. And they offer a ability to use that debit card to pay for food and utilities, which is a huge selling point. If you can imagine somebody who's on a fixed income, you can get 25% of your income in a debit card to pay for these things. It makes a huge difference. However, what happens is you lose a lot of your access to care. Your network is smaller. You can't get care as quickly. It has to go through the scrutiny of prior authorizations. You have to go to providers that they allow you to see. And some services, frankly, are not offered. In exchange for this monetary monthly debit card. And so the other pitfall is that the way that you use it to pay for your utilities has to go through their website. So if you're not comfortable on that, then you may not even be able to access that benefit. Same thing with dental plans. Sometimes the dental plans will have a benefit, but there's a 50% copay. So if you get a $1,500 bill and you don't have the money to pay your 50% copay, you don't get to access that service anyway. So you signed up for a benefit that you realize that you won't even be able to access sometimes. So just kind of play those scenarios out, see if they make sense for you, and understand that when you're surrendering your Medicare to get an Advantage product, you do lose something. You certainly do lose that original Medicare and that free access to make your own decisions about where you get care.
What are some of the main differences between Medicare and Medicare Advantage?
That being the network is the biggest thing, is that the insurance companies are trying to cost contain. They're trying to save money. And so while they do that, they restrict your access to care. And then some of those things could be, if let's say we order an MRI because you have back pain, they may indicate first we have to do an x-ray. So if you're in back pain and you're elderly and you have transportation problems, now you got to get a ride to go get an x-ray. And then after x-ray comes in, the doctor really didn't need it because it's not going to show us what we need to see. Then we'll call the insurance company and says, okay, we got your x-ray. Can we get an MRI now? Because we're really concerned about this back pain. Well, did they try physical therapy first? No. Well, they need to try 2 weeks of physical therapy and fail that trial. So then we call you again and say, hey, we need to do physical therapy for you, but I don't think I can do it. I'm hurting so bad. Sorry, ma'am. All we can do is tell you what the insurance company told us. Otherwise, we can't get the MRI paid for. That's real life scenarios that you don't plan for. You don't know is going to happen. But what happens at the end of the day is you don't get the MRI. You might get better, but you might not. But we've delayed a lot of time. We've delayed your ability to get care. Whereas if we don't have those obstacles, you could have already had, treatment, maybe even surgery by now.
Yeah.
So those scenarios are the things that kind of we should be concerned about when you choose those Advantage plans, and understand that accessing care is going to be quite different.
Sam, does everyone always have a choice between Medicare and Medicare Advantage, or are there any people who can enroll in one but they can't enroll in the other one?
So with Medicare and Medicare Advantage products, you can never have both at the same time. So Medicare is your insurance that you've paid for from your very first paycheck to your very last paycheck, and that is your money, your benefit. It's something that you have earned. And so now what happens is you surrender that entire benefit to go with a private insurance company. So you can't have both. You can have Medicare and a supplement plan, which is very, very different than Advantage plans. Supplement plans just support what Medicare already does. They don't have the restrictions that an Advantage plan has. They do one very simple task. When Medicare pays a bill, supplements come behind them and pay the rest. It is a very different type of plan that you can have both. But with an Advantage plan or Medicare, it's an either-or option. But we all have a choice.
Can people switch back to Medicare or Medicare Advantage? Because you did mention in the beginning that you can put your feet in the water. So can they switch back to Medicare or Medicare Advantage if they've tried one and didn't like something about it?
Yes, that period from January 1st through March 31st is the one that, if things aren't going well, call 1-800-MEDICARE and they can get you switched back.
Okay. And do all providers take Medicare, or do all providers take Medicare and all of the different Medicare Advantage plans that are out there?
That's a good question, yes. So most providers accept Medicare. So the exclusions would be if you had a concierge or a private fee service, and some providers are going to, or if you were excluded from participating with Medicare because you committed fraud. So there's providers who can't. But typically, Medicare is very easy to credential with. There would be no real reason for a provider not to take Medicare. But Medicare Advantages are very different. If they're HMOs, you have to sign a contract. And so if I'm a Medicare Advantage product and I'm an HMO, I have to have 2 contracts of every specialty in my service area. But that's all. So if we have 30 cardiologists, I'm only required to have 2 of them in the network. So it could be very, very different. So yes, more restrictive with Advantage plans, less choice. Medicare will be very hard to find a doctor that's not taking Medicare.
Sam, what are some of the common misconceptions that you hear about Medicare?
I think who's entitled, how do you get it, when do you get it, I think what it covers. And so, Medicare is for those of us who turn 65 or who become permanently disabled after have worked 40 quarters or basically 10 years. So once we've paid into the Medicare system and we become permanently disabled after that period, we can start receiving Medicare. The trick is it takes 2 years from the date of being disabled that you start receiving Medicare. So that's something that people don't realize until something like that has affected them or one of their loved ones. So that would be the biggest one. So if you think about us, we're all just one really bad car accident away from being at home and not being able to work again. And is Medicare going to be there for us? They are, but it's going to take 2 years before it is. There's a couple exceptions if you're on dialysis or you're diagnosed with ALS, but otherwise that's going to be a tough 2 years for people who are trying to figure out how do I get coverage and what do I do in the meantime. So yeah, Medicare is a great safety net for folks, but there are some holes in it.
Ladies and gentlemen, in the studio, Mr. Sam Hutchinson. Mr. Hutchinson is a social worker and office manager for Cape Fear Valley Health Senior Health Services. And he's our guest today on Cape Fear Valley Health's Making Rounds Live. Let's talk about the changes for this year or the upcoming changes for Medicare or open enrollment. We were talking about this before the broadcast. Got to go ahead and say it, Project 2025. Medicare has a big old target. So what changes are in store?
That's tough to speculate on, but there is some very concerning comments about what the future of Medicare will look like in this country. So certainly invite people to kind of do their research, see where the candidates stand on these issues, see if these things make sense. The one particular line item was that Medicare Advantage plans would be the default insurance. That means that is what you would get unless you insist on not having it. And so that certainly will be a very different enrollment period if that is something that actually comes to fruition. So yes, there are certainly some concerns. You certainly have to keep an eye on what people think about the way they feel about Medicare or Medicaid or Affordable Care Act and how that may impact you guys. So just stay informed and try to make your voice heard.
And I guess lastly, Sam, is there anything about Medicare or open enrollment or senior health services that you want to stress to our listeners before we let you go, or maybe something I forgot to mention?
Yeah, I don't want to sound so negative. I think we've been kind of pessimistic on this, but there's some good things that happened this year. So this year we've experienced for the first time the end of something called the donut hole with the prescription drug part of the plan, which is if people have heard of it, then it definitely has affected you. If a pharmacist has said to you donut hole across the counter, that means a lot of money for you. And what that was a system in place where when you're paying for your medications with a prescription drug plan, that there's a certain point in the middle of the year when you become responsible for a greater percentage of the cost of that medication. It started to get reduced years and years ago, but this year they finally got it where it's eliminated. The problem with that was it was causing people to be compliant with their medications and then in the middle of the year having to start to do things like ration or skip taking medications because the expense was just too high and they hadn't budgeted for it, which was horrible for outcomes for all kinds of disease processes. So this year they've gotten rid of that donut hole. The consistency in what you are paying at the pharmacy will be there throughout the whole year. They've also capped the maximum out-of-pocket to $2,000. This is a really big deal. This will change the landscape for what patients have been experiencing for the cost of prescription drug plans. So that certainly is a very good thing that we have to look forward to this year.
Now, one resource that just popped into mind when we were talking, you were talking about medications, CCMAP, Cumberland County Medication Assistance Program. Can they help with Medicare patients receiving their medicine, or is this one of the resources that they wouldn't be able to touch?
Typically, they're unable to assist with people who already have insurance, but there are exceptions in the way that they have some medications that are have special pricing on them. So with the Medicare drug plans, what happens is sometimes the pharmaceutical manufacturers will have programs to help cover the cost of medications. If you ever see a commercial on TV, the golden rule is don't ask for it because you can't afford it. And that's true. Those things are expensive. Medications are coming to market routinely $3,500 a month. Yes.
Medication?
Yes.
$3,500 a month?
Yes. If you've seen a commercial for it on TV, if you want to go Google search the price of that, you'll be floored. So those commercials are expensive. The research that they spend on coming up with these medications is expensive. And when they bring them to market, they don't cut the price of them, but they create organizations that are designed to help people afford those medications. And CCMAP bridges you to those programs and helps you get those medications at an affordable cost. But for how long and how long is that sustainable, those are always very complicated. So CCMAP does some wonderful work for uninsured and underinsured people. So always use them as a resource. Always give them a call and check and see if they can help you in your certain situation. But right now is the best way to save money. If you're concerned about saving money, check with your plan. Go to the Medicare website. Type in the medicines that you are on. Put in your zip code. Put your favorite 4-5 pharmacies in there. You can compare the pricing. Going to Walgreens may be cheaper than going to CVS. And just because somebody says, hey, I got this plan, it's great, it'll be great for you, it won't. The only way for the plan to be good for you is if you were both sharing the exact same medications. It's all based on what particular and what unique list of medicines you're on. And the Medicare website will factor in co-pays, premiums, deductibles, and give you an annual cost of that medication. It truly is the only way to know for certain how much that's going to cost. So don't underestimate that, oh, well, last year it worked for me. Oh, hey, my wife has it and it works great for her. Unless you're sharing those medications, it could be very different for you. Just one medicine could make or break your budget monthly.
And finally, Sam, someone wanting to get in touch with you or Senior Health Services at Cape Fear Valley, give them that information once again.
Sure. So Senior Health Services, the main number is 910-615-1630. We serve patients who are 60 years or older as primary care and geriatrics. My direct number is 910-615-1633. And I'm a social worker there at Senior Health Services. I can help with the medication questions, the open enrollment questions, general resources for seniors, in addition to support for caregivers of patients with Alzheimer's disease.
And what age should we start reaching out to you, Sam?
Well, if you're calling about a family member, anytime. If you're calling about yourself, 60 years or older. But, anybody, the rule is if you think I can help somebody, just give me a call.
All right. Ladies and gentlemen, in the studio today, Mr. Sam Hutchinson. He is with Cape Fear Valley Health Senior Health Services. We've been talking about Medicare. We've been talking about open enrollment. We've been talking about the Senior Health Services and the services that they offer the community. Sam, thank you so much for being on the broadcast today.
Thank you for having me.
So, ladies and gentlemen, let me see. Make sure I've asked all the questions of Sam. Yeah, I've asked all the questions. So, ladies and gentlemen, our next broadcast will be. Hold on for just a minute, because I have lost my paper here. Our next broadcast is. Lindsay, holler at me real quick. Just I have lost my paperwork. November 26th. November 26th is the next broadcast, 2 days before Thanksgiving. And for our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the hardworking and amazing team behind the scenes, because I would not be able to do this without them. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
This is Pastor Reginald Johnston of My Father's House Christian Church. You're listening to Wake Up.
A package that would address the direct needs of victims, particularly business owners, is in the works, according to Western North Carolina Republican members of the state legislature. The deadline for people to apply for assistance after Hurricane Helene has been extended.